Welcome to the latest edition of the PetSmag podcast. Today on the podcast, we're joined by Dr. Stewart Halperin. He's the founder of the Stem Cell Vet, a pioneering force in veterinary regenerative medicine here in the UK. Welcome, Stewart. It's so lovely to have you.
Oh, thanks so
Stewart,
much for having me. Yeah.
delighted. Stewart, can we begin with a little bit of background? What is the stem cell vet and how did it all begin?
So the stem cell vet is a veterinary practice that is specific to treating dogs with arthritis. Okay, so we see dogs from all over the country being all over the United Kingdom. Currently, occasionally we see a dog that comes in from Europe, um, who in almost every case have been to their vet, sometimes been to two vets, sometimes been to a specialist or referral practice, have tried conventional therapies for arthritis, so stiffness or pain in joints. Those conventional therapies being a whole host of things from hydrotherapy and physiotherapy to non-steroidal anti-inflammatories to other medications and so on. And they just need a bit more help. Okay, so people will either find us online searching for help or information for my dog with arthritis, or their vets will refer them to us. And and what we do in our clinic is that we use a multimodal approach. So we look at all of those things that I've just talked about that can help arthritis, but we also use what's called regenerative medicine. And regenerative medicine is the branch of medicine that helps to repair or regenerate damaged tissue. In the case of arthritis, that's tissue in joints, cartilage, and joint lining, we call the synovium of the joint, where it's inflamed or damaged, either in young dogs for congenital reasons, so things like hip dysplasia, elbow dysplasia, and then in older dogs, usually wear or tear or damage, or sometimes from injury. And how we give regenerative medicine treatments, of which stem cell therapy is one, is that we inject them directly into the joints. So rather than giving injections under the skin or giving tablet medication, we're giving treatment directly into the joints, literally putting a needle into the joint space between the bones and injecting stem cells. We also use something called platelet-rich plasma, joint fluid replacement therapy as well, which helps to lubricate the joints. So we use in every individual dog, depending on what they need and which joints need treating and which treatments are most appropriate, a combination of these treatments. And the sole aim of the clinic, to answer the rather long-winded answer of your question, is to help the dogs that we see become pain-free and mobile. Okay, and that does so to us. It doesn't matter if we use stem cells or we use this, that, or that. It's whatever is most
So this
appropriate for
is
each
this
dog.
is pretty groundbreaking stuff. It's not the usual course of treatment in circumstances like this.
It's not the usual course of treatment, and that probably is because for most general veterinary practice, vets are working incredibly hard, doing an incredible job. I know because I did this for
Mhm.
30 years. Seeing in a busy practice a dog or a small animal, whether it's a dog or a cat or a rabbit or a hamster, every 15 minutes.
Mm.
And so, for a vet to, welcome a dog owner in case of a dog, find out what the problem is, do a clinical examination, come up with a list of possible things it might be, some treatment options, talk the owner through it in 15 minutes. It's an incredibly hard job, almost impossible in a way. But this is what vets are doing day in and day out. And what we do at Stem Cell Vet is we have, for each dog that we see, we allocate one vet and a nursing team for the whole day for that one dog. So they only will see one new case a day. And the reason we do it that way is we feel like dogs with arthritis, especially those that don't respond as well as we would like to conventional treatments, or might have responded at first and then don't do so well. They need time, and they need time to understand exactly what's going on through the owner's eyes. Vets need time to do full examinations, orthopedic exams, neurological exams, and so on. We take some particular tests, stance analysis, and so on that we use to check joints.
Mhm.
Then to do some diagnostic imaging where it's needed, then to make an assessment of exactly what this dog is most likely to benefit most from, and then discuss that with the owner, then go ahead and do treatments. And all of this is done on the same day, but nonetheless, it just takes some time and some focus and some application that, with the best will in the world, vets in general practice they're not given the time to do it. And so we set up this clinic which is bespoke to that. And we find on the basis of that, and also very careful case selection. So we have a case screening process where if someone approaches us for help with their dog, there's a process that we go through with them. We ask them for some videos so our clinical team can see the dog moving, of course, and then we communicate with their primary vet or vets to get all of the clinical information
So
that we need so we can.
sorry, Stuart, does it start with a
No.
veterinary referral from practices throughout the
Um,
UK? Is that how they come to you?
Yeah, so it doesn't have to be. So one way or another, we have to speak to through professional due diligence,
Mm,
professional courtesy, and also due diligence in terms of us knowing what's been going on with the dog. From a medical point of view, either vets will refer cases directly to us, or and they can do that through a web form on the website, or give us a call, or dog owners approach us directly. Now, if they approach us directly, we still need to contact their primary vet and say, hey, Mr. or Mrs. So-and-so has contacted us. Would you be able to send over clinical notes? They have to get the owner's permission to do that. Then we will have a look at all those clinical notes together with a phone consultation with the owner, together with a set of videos that the owner will send in. We'll make a decision on that basis as to whether we feel we can help this dog or not. Because we want to see dogs that we can help, of course, and we don't want to waste people's time or money coming to see us if for whatever reason the treatments might not be appropriate. Yeah.
And thank you for that. It's absolutely
Hmm.
fascinating.
No problem.
Yeah, I believe you had some earlier inspiration for your work, a childhood experience of losing a dog, a beloved dog.
Yeah, I mean,
Correct. Can you
yes,
tell us a little bit
we had
about
a
that?
yeah,
That'd be
we
great.
had a family dog called Benji, who was a sort of mixed breed kind of, mutt, but he was
Mm,
very much
mm,
loved. And when he got a bit older, he was getting to 11 and 12, and he started, never had a health problem his whole life, and then started just to be very stiff, trying to get up on his back legs, and then not wanting to exercise much, and so on. And so my dad had a friend, Tony, who was a vet, local vet. Um, and so we took him to Tony, and Tony took some X-rays and had a look at him and said, "Look, he's got arthritis in his hips. Try
mm,
these tablets, but that's pretty much all we can do." And actually, the tablets were non-steroidal anti-inflammatories, not dissimilar to those that vets we all still use today, just
mm,
not that dissimilar. And I sort of thought, well, I want to see a specialist, let's go and see a specialist and see what we can do for Benji. So we went up to the Royal Vet College in London. We saw the orthopedic specialist. He put the X-rays up in those days, the X-rays up on a light box kind of thing, before the days of digital X-ray.
mm,
And he said, yes, he's got arthritis in his hips, and there's nothing more we can do. And I was like, I'm 12 years old or something like that. So I was like, but you're a vet. I didn't say this, but in
mm,
my head, I was like, but
mm,
you're a vet. There must be something more you can do, because that's
mm,
what kids
mm,
think, right? That.
mm,
And so, look, I became a vet, not to sort of try and get revenge and be a superhero or anything, but it was just, I was also obviously loved animals and good at sciences and so on. But the clinic was set up on the basis that, as best as we can, we don't have to say that there's nothing else we can do. And there's such a range now, more in now these days than in those days, of things that we can do for arthritic dogs. That might include stem cell therapy, and might include lots of other things. And so just taking the time with dogs because I think, there's people underestimate how much discomfort dogs can be in with arthritis. And it's like us, if we have, I mean, I have my knee, that sometimes, and
mm,
it's like, well, it's kind of debilitating because you can't exercise, can't run
mm,
around,
mm,
it can be sore at times. And so, and same for dogs. And actually what we see when we treat these dogs, and they become pain-free, is that apart from being mobile and they want to do more exercise and so on, they're so much happier. And we often see behavioral changes as well, like dogs who have gone from being very friendly
mm,
to
mm,
withdrawing a bit and sometimes snapping and so on.
mm.
Once we help them with their pain and their mobility, the behavioural changes as well as their mobility changes can be quite extraordinary. So, of course, they can't tell us they're in pain, but there are lots of signs,
Mm.
you know, even without examining them clinically, that can tell us they're uncomfortable. So, our
What would those
our
signs be? So
yeah.
the
Oh,
lethargy, holding a joint up.
yeah. Dogs can, so obvious things like holding a leg up where they're lame, it's just too painful to put down. more subtle signs of lameness. So sometimes this can be head bobbing. So
Mm,
the dog's head might go down when a front leg hits the ground,
mm,
and that front leg usually, when the head goes down, is the one that's more comfortable, and they're trying to take weight off the one
mm,
from the opposite sides. They're not putting weight on, and so head bobbing is one. It's
mm,
just difficulty rising, stiffness, especially after exercise. So if they've been out for a long walk and then the following morning they're very stiff to get up, it can be a sign there's some arthritis going on.
mm,
Um, Sometimes, as I said, changes in behavior. Sometimes they don't want to go upstairs or downstairs. They don't want to jump on and off the couch. They don't not happy to jump on and off, in and out of cars. Um, and all of these things can be signs. They can be signs of other things sometimes, but they can also be signs of arthritis. And some are more obvious, like you said, they're lifting a leg up. Okay, that leg's probably sore. But then almost, well, is this, yeah, almost always it's not quite as obvious as that, where we see dogs
mm,
that are holding a leg up.
mm,
It's because dogs naturally, as you know very well, and I'm sure
mm,
a lot of listeners will know, um, they're stoic and they tend to hide pain, and there are reasons for that.
mm,
Ancestral reasons that they don't want to be seen to be weak,
mm,
and left behind from a pack and so on. There are also um, very stoic in the sense that they just hide pain, but they don't want to show it very well. They want to please us. They want to, look like everything is they're doing okay and they can keep up and they can go out and walks and all those things. But sometimes they're struggling, and so we have learned to pick up some of the more subtle signs of arthritis when we examine dogs and we do various flexion tests and stress tests on their joints. Then it can become obvious. Sometimes we see dogs who, if you saw them on a video or out for a walk, you'd be like, this dog is absolutely fine, there's no problem.
mm,
When we see them but the owners know they're not quite right, and when we see them at stem cell vet, we do examinations. They're very sore in an
mm,
elbow, or they're very, we can see these things. So more often than not, there's subtler
mm,
signs. Yeah,
mm, mm. Thank
yeah.
you. You're
Mm,
clearly hugely passionate about regenerative therapies in animals.
mm, mm.
Are you an advocate of the one medicine principle as supported by Professor Noel Fitzpatrick, where breakthroughs in veterinary medicine can benefit human health and vice versa?
It's a really good question. And the answer is absolutely yes. I feel there. So in stem cell therapy in human medicine, though it's becoming more prevalent, and there are some famous, particularly as athletes, so Tiger Woods, golfer, obviously golfer, Ronaldo's footballer, sort of have, publicly stated that they've used stem cell therapy for their joints and so on, and it's becoming regenerative medicine and human medicine, so injections directly into joints for arthritis, platelet-rich plasma, particularly in this country, is becoming much more prevalent. And on the other hand, there's still a gap between people's knowledge and understanding, and there's this sense of stem cell therapy. You kind of sometimes read about it in the Daily Mail or what have you, and someone's
Mhm.
eyesight's been saved, or someone's had a heart treatment, and then it disappears for a few months. You don't hear about it. My view, from the almost 1,500 dogs that we've treated with, we have what we call clinical metrics, so ways of collecting data around how well they're doing,
Mm,
um, is that it should be something that it will be, well, there's no question that it will be something that becomes more prevalent in human medicine, and
mm,
that it should be, because there will be cases of arthritic joints in people that have, um, you know, look, one of the first things we look for when we're selecting our cases for appropriateness is this a surgical case or not? Does this dog need surgery, right? And if it does, it's a surgical case, and it's not something that we might treat afterwards, helping, but not immediately. They need to have surgery. They need to have surgery. Nonetheless, there will be cases in human medicine where people have surgery and they didn't necessarily need it. These regenerative therapies can be extremely helpful in reducing pain and inflammation in joints,
mm,
helping to repair and regenerate damaged tissue. Um, and so I think it's really important,
mm,
and I hope at some point that our clinic will be helpful for human clinics that set up and we say, look, these are our protocols, this is how we do it. Um, and and that might be beneficial to transpose over to human medicine.
okay,
Yeah.
wonderful. We're coming to the end of the show
Okay,
now.
sure. Yeah.
How do you see things developing in the next 5 to 10 years, do you think, for instance, AI will have an impact on where these technologies go?
Think that AI will have an impact. So there are some technologies coming out now, for example, video technologies that use AI to look at gaits, so movement in dogs and also in horses.
Mhm.
Though it's stem cell that we just treat dogs and sometimes cats, we don't treat larger animals. Nonetheless, video analysis of gait. So where a dog isn't obviously lame from, and showing some of the signs we talked about, but the gait's just a little bit off and he's favoring one leg over another. Um, a video analysis using AI, where AI is fed, look, this is how long a stride should be for this breed and kind of dog, breed and age of dog. Are there any anomalies in this? What might that mean? And where to look in terms of doing further diagnostic imaging and so on. Will definitely come into the sort of wider veterinary world because it can be very helpful. And sometimes AI technology can be better at things than I hate to
Mhm.
say this, I'm sure I'll be
Mhm.
unpopular with some people. It can be better at some things than we can be. And sometimes, I mean, I use AI, lots of people are using it for various things, and
Well,
I'm
it's
quite shocked sometimes
it's
at how
it, it's becoming that way, isn't it? It's going to
it's becoming
overtake
that way.
us if it hasn't already.
So I think that's an example of where will come in and will be helpful in diagnosing things like
Mhm.
abnormalities
Mhm.
that are there
Mhm.
because there's joint pain. Yeah.
So it's a hugely exciting time to be in this field,
Mm.
definitely. Stuart, that was absolutely fascinating. Thank you so much for joining us today. It's been an absolute pleasure, and I've certainly learned a few things, and I'm sure the listeners have as well. So thank you. Thank you.
Yeah, you're very, very welcome. Thanks for having me.